Are you finding that your bunions are making a simple activity such as walking difficult and uncomfortable? When you visit a shoe store, is it hard to find shoes that fit? Are your bunions interfering with doing fun activities with your friends and family? Has exercising become too painful for you to stay at the gym? When you take a look at your feet, do you feel the bunions are causing your feet to look deformed and unattractive? Well, you have three options when it comes to your bunions. The first option you have is to do nothing. The problem with doing nothing is that most likely your bunions will continue to grow worse the longer you wait. The longer you wait, the harder it is to address. This means that conservative treatment for bunions becomes less of a possibility, and surgical intervention may become more difficult due to increased recovery time and the progressive nature of the bunion itself. The second option is to have a bunionectomy or bunion surgery. Surgery involves dissecting your foot, breaking your big toe, tightening your ligaments on the outside of the toe, and releasing your ligaments on the inside. This process requires months of healing and rehabilitation. It can take anywhere between 3 months to a year in order to heal entirely. Not to mention, after all the anesthesiologist fees, hospital fees, surgical center fees, pre-op fees such as x-rays and tests, pain medication, antibiotics to prevent infection, equipment such as crutches or a wheelchair, and post-operative shoes, the total can run anywhere between $5,000 all the way up to $30,000 depending on the severity of the case. What are the risks of surgery? Infection, nerve injury, and continued pain, long-term stiffness, scarring, and over or undercorrection of the big toe. As a side note, a popular study has revealed that up to 33% of people who have had bunion surgery are disappointed in the results. This is due to either residual pain or the recurrence of the bunion itself after surgery. Finally, we have option number 3. This option involves treating your bunions conservatively, naturally, and safely. This means absolutely no recovery time, no downtime, no scarring, no risk of infection, no possibility of nerve injury, no long-term stiffness, no over or undercorrection of the big toe. This revolutionary treatment is called the 12-point bunion no surgery method, performed exclusively by Dr. Robert Livingston, located in beautiful Denver, Colorado. The 12-point bunion no surgery method focuses on holistic techniques and technologies to realign the big toe and shrink your bunions. Of course, we want to reduce the chances of your bunions coming back, so how do we do this? We align your ankle and foot, correct any muscle imbalances and nerve functions, improve your foot health, joint motion, range of motion, muscle strength, and correct bad posture you may have. We also decrease any foot swelling, joint inflammation, muscle tightness, and pain in your body. All these factors affect your gait, or the way you walk. By walking properly, you inevitably reduce pressure on your big toe, thus reducing the chances of your bunions returning. This is a critical value-added service included within our method. For more information on this revolutionary bunion surgery alternative, please visit buniontreatmentinfo.com and receive your free report on why you should think twice about bunion surgery. You also have the option of receiving a free, no-obligation consultation with Dr. Livingston personally. If you prefer calling, our number is 303-532-4844. We look forward to hearing from you and helping you solve your bunions conservatively, naturally, and safely.